Do you have joint pain along with having osteoporosis? If you do, you're not alone. In today's video, we're going to talk about how our joints and bones work together and begin looking at how to reduce joint pain and also improve our bone health naturally. Hi, I'm Sarah, and I'm a certified nutritional health coach through the Institute for Integrative Nutrition, and also a 500-hour trained yoga teacher with additional training that's specific to osteoporosis and yoga. I believe that there are things that we can do to improve our bone health and our health overall at every age and every stage of life. And I'm glad to have you join me in the journey to better bone health. Let's go over what our joints do and how they're connected to our bone health. Our joints are the points where two or more of our bones meet. It's our joints that allow for flexibility and movement in our bodies. We actually have several different types of joints. There are fixed joints that have very little to no movement. Picture your skull here. We also have joints that allow for slight movement. These joints are connected by cartilage. The spine is a good example of this type of joint. We also have our most common type, which are called synovial joints, because they're filled with synovial fluid. Synovial joints reduce friction. Our knees, hips, and our shoulders are good examples of synovial joints in our bodies. The main job of our joints is to create stabilization. Our joints connect to our bones by ligaments, tendons, and muscles, which provide strength and flexibility. Our bones and our joints work together. This happens when our muscles contract and then pull on our tendons, which move our bones at our joints. In our synovial joints, the fluid allows for smooth movement. The cartilage in our joints provides some cushioning and helps to prevent our bones from rubbing directly against each other. On the bone health front, keep in mind that we need our muscles and our ligaments to pull on our bones, putting good stress on them. This is what actually stimulates new bone growth in our bodies. Basically, our bones and our joints need to both be in good shape. If our bones have trouble, our joints do as well. When we have pain in our joints, it can be more difficult to give our bones the exercise that they need to increase in strength and quality. Joint pain is not a pleasant experience, and it can be caused from a variety of sources, including inflammation, wear and tear, underlying medical conditions, or an injury. Arthritis is one of the most well-known causes for joint pain. There's osteoarthritis, which develops from wear and tear on the cartilage that's supposed to provide padding for our bones. When the cartilage becomes worn down, it can cause bone to rub on bone. When bone rubs on bone, it can also cause the bones to lay down extra bone in an attempt to protect itself, and a bone spur develops that's painful and not helpful. Thanks, but no thanks, body. Arthritis can also create pain, stiffness, and visible swelling. There are also a myriad of other types of arthritis that are caused by autoimmune conditions. One type of autoimmune arthritis is rheumatoid arthritis. With autoimmune arthritis, the immune system mistakenly attacks the joint lining, which causes inflammation, pain, and visible swelling. I'm unfortunately very familiar with this kind because I have rheumatoid arthritis. I have really regular pain every day in my swelling in both hands and in my feet, and I'm continually working at reducing inflammation, swelling, and pain in my body. Today, we're going to talk about ways that you can reduce these symptoms naturally. I can't eliminate my symptoms, but I am able to reduce them and deal with them in a natural and holistic way. And that makes a huge difference in my quality of life, and I hope that it will in yours too. Another autoimmune issue that can cause joint pain is lupus. This is because of widespread inflammation that develops all over the body with lupus. An additional inflammatory issue that leads to joint pain is bursitis. Bursitis can develop from too much of a particular repetitive motion. Some examples of this type of movement include playing tennis, playing baseball, or even gardening and doing the same movement too many times. Some infections could lead to joint pain. Some bacterial infections lead to severe swelling and pain. Also, Lyme disease, which is caused by tick bites, can lead to joint inflammation, particularly at the knee joints. Injuries such as sprains and strains can lead to overstretching and possibly even tearing a ligament or muscle, which can cause joint pain. Also, osteoporotic fractures that create misaligned bones can lead to having joint pain. Some of our lifestyle choices can also contribute to joint pain. When we're sedentary, the lack of movement can lead to stiffness and discomfort in our joints. Movement is important here. Stress can lead to chronic inflammation that can contribute to joint pain and developing osteoporosis. When we have poor posture, it puts additional stress on our bodies, and that includes our joints. Obesity brings extra weight for our bodies, and the extra weight can put extra pressure on our knees, hips, and spine, creating pain in our joints. If you have joint pain, it's important for understanding what causes your joint pain so that you can work to manage what's happening in your body through lifestyle modifications, and in severe enough circumstances, getting the right medical treatment and attention for your situation. So now that we have an understanding of what our joints are supposed to do, how they work with our bones, and what potential causes of pain include, let's begin our discussion about what we can do to reduce joint pain naturally while also improving our bone health. We'll start with things that you can do related to movement and exercise, and then we'll continue our discussion about other ways to reduce joint pain and improve bone health later on this week. So it's incredibly important to move regularly. When we stay sitting for too long, we get stiff. It would be really easy for me to have a bad day with my own arthritis and to say, I don't feel very good and I'm not going to move today. My hands hurt, my fingers are swollen, and it's hard to do things. Sometimes the swelling is really bad and I can't do things. When this happens, I really work hard to be patient with myself. When I have a really bad flare-up, then I give my hands a few days until the inflammation goes down. Except for on those really bad days, I force myself to move. I feel stiff every morning when I get up. I move slowly. It's kind of like I shuffle across the floor because my feet hurt. I find that having a warm shower really helps to be able to move my hands and my feet. And then I start gently doing some yoga. I warm up my body slowly, gradually, working into different parts of my body. I might get to energetically moving, but it takes me a while to get there with my joints. When I've had a really bad bout, it's always harder to get myself to start moving again. But I start again because if I don't, it would be really easy just to curl up in a ball and stop moving altogether. That wouldn't be much of a quality of life. Working with chronic joint pain, I carefully listen to my body. Sometimes I only do a little bit. The thing is that a little bit helps. It makes it easier to do a little bit more the next day and the day after that. When I have a flare-up, it does set me back. But as it recedes, I try again and I work myself gradually back into a better place. Movement is important for working with painful joints. It can be a slow and gradual movement, but movement is absolutely crucial for decreasing pain and for maintaining the use of painful joints. To improve joint health, it's helpful to have a combination of strength training, stretching, and flexibility exercises, along with some range of motion exercises. For strength training, you could use weights, resistance bands, or your own body weight. This will benefit both your joints and your bones. Our bones need strength training to stimulate new bone growth. With our joints, it's helpful to use smaller amounts of weight and to do more repetitions. So if you were to do 3 to 5 repetitions of an exercise with a really heavy amount of weight, you might try doing that same exercise or a different exercise with light weights and then repeating the exercises more like 10 to 12 times, just as an example. Stretching is incredibly helpful for joint health. It's also important for bone health. Stretching will help to reduce stiffness in the joints and to maintain mobility through our joints. Stretching helps to restore the balance of our bodies. It can lengthen muscles that are especially tight. Stretching actually helps to increase blood flow throughout our bodies, which increases the amount of nutrients that are carried throughout our bodies. Stretching also increases the amount of synovial fluid that's produced that helps to protect joints like our knees and to prevent injuries. It's helpful to do a combination of dynamic and static stretches. Dynamic stretches include moving while doing a stretch. This type of stretch can be a great part of a warm-up to your exercise routine. Static stretches are where a person holds a stretch for a particular length of time. This kind of stretching is best done after our muscles are warmed up, and it can be a great part of a cool down. Some of the best exercises to work into our joints are slow half neck rolls, ankle rolls, shoulder rolls, and knee extensions. Each of these exercises help to maintain normal joint function and to reduce stiffness. This is where we'll stop our discussion for today, but we'll continue it later this week, so keep an eye out for that video where we will continue discussing how to reduce joint pain and to improve our bone health naturally. If you found this video helpful, please share it with someone that you know and love. And there are a couple of references in the description below in this video if you'd like to explore these topics further for yourself. And on that note, I look forward to continuing our discussion later this week.